During the pandemic, Melbourne business Pack Queen has been manufacturing tens of thousands of face shields with surging demand from health providers.
They've all been really desperate to actually get their hands on any type of PPE equipment.
Personal protective equipment, or PPE, is vital for frontline staff. Today, another 140 healthcare workers have been diagnosed with COVID, bringing the total number of active cases in the sector to 998.
I want to give a shout out not just to our nurses, they're doing an amazing job, all the team across our health system.
But around 20% of nurses surveyed by the Australian College of Nurses have reported not having appropriate PPE available for every shift.
They're getting rationed on the number of masks that they can use. Some nurses have had to buy their own uniforms or masks or face shields.
One anonymous nurse employed at a large public hospital telling 9 News, "We are expected to take COVID scrubs home to wash, and some staff are not bringing in clean scrubs and continue to work." But the Chief Health Officer has rejected the claims.
My understanding is there is no statewide shortage of PPE.
The Premier says his government has a stockpile of 68 million gloves, 19 million surgical masks and more.
There are adequate stocks. There's an enormous amount of work that's gone on to get that PPE that's sitting in the warehouse.
The Australian Nursing and Midwifery Federation believes there is enough PPE, and most of the queries it's receiving from nurses is in relation to donning and doffing, that is, putting on and safely taking off protective equipment.
I do believe we have enough supply here in Victoria. We have millions of gowns, face shields, N95 masks.
And there are plenty more at hand.
Get in touch with us. We have ample supply and we're more than happy to help.
Emily Rice, 9 News.